Yuma is a city in southwestern Arizona known for its agricultural prowess, particularly in the production of winter vegetables. However, the region faces significant sustainability challenges, primarily due to its arid climate and reliance on the Colorado River for water. Efforts are underway to explore the future of water sustainability for Yuma's farming sector, which is crucial given the region's dependence on agriculture. These initiatives highlight Yuma's commitment to sustainability and the ongoing efforts to balance economic growth with environmental responsibility. In the heart of Yuma lies Envita Health, a growing healthcare organization comprised of a 405-bed acute care hospital, a freestanding emergency department and urgent care clinic serving the residents in the eastern part of the county, a cancer center, various ambulatory clinics, and a future hospital that will serve the residents in the southern part of the county. Here at Envita Health, our purpose is first and foremost to build a healthier tomorrow. We accomplish that purpose by putting patients first, being rooted in the community, and being committed to progress. Looking closely at our values, it would make sense that sustainability in our organization would be a priority. A sustainable structure can be defined as one that conserves resources, is effective from ecological, social, and economic perspectives, and addresses the various interests of stakeholders. Literature suggests methods for improving sustainability in healthcare systems. However, there is no consensus on feasible strategies for implementing the proposed sustainability measures. Healthcare organizations are designed to preserve and improve public health, but their environmental impact can negatively affect the well-being of humans and other organisms. Therefore, the sustainability of hospitals and healthcare facilities is crucial for promoting human well-being and health. However, it is essential that sustainability measures in healthcare do not compromise the quality of service, access to, or affordability of healthcare, ensuring benefits for both businesses and customers. A significant issue in healthcare sustainability is the management of waste disposal and air pollution. Klangson and Harding highlighted that medical waste has become one of the top pollutant sources worldwide, significantly affecting disease spread and the quality of air, water, and soil in and around healthcare facilities. Thus, it is imperative for healthcare organizations to have a multidisciplinary team addressing various aspects of sustainability. Additionally, public healthcare has a substantial impact on national economies, accounting for 20.3% of the United States GDP in 2024. Therefore, sustainability measures in the healthcare sector are necessary to mitigate its negative impacts on the environment and the economy. In my assessment of our organizational steps taken to address sustainability, it has been difficult to locate such information. There are a few departments that intermittently address sustainable practices, but there is not a concerted organizational effort. As such, I reached out to our Director of Facilities for data regarding our carbon footprint. She was able to provide me some data she was privy to, but that only included those areas she is responsible for, which is waste management of sharps disposal and biohazardous waste. As such, information is siloed in various departments. An organizational audit should be conducted in the near future to help get a grasp on the magnitude of our organizational carbon footprint. Given I cannot make huge changes for the entire organization, my idea for a sustainability project is to add a recycling program to our surgical services department. As we currently do not recycle, that is a large area of opportunity for our department. Immediately, we can make an impact in decreasing waste by recycling cardboard. According to data estimated from a like-sized organization, our organization could be putting between 850,000 and 1 million pounds of solid waste into the landfills every year. If we would begin recycling all of our cardboard products, we could decrease that amount by over 400,000 pounds. Sounds easy, right? Break down the boxes, stack them up, put them in a baler, and send them to a recycling plant. If it was that easy, this would be a chip shop project. The difficulty lies in the logistics of recycling cardboard. We are dealing with a medical facility, therefore everything is labeled medical waste. That waste is a whole other ballgame. Therefore, many stakeholders need to be brought to the table in order for this project to come to fruition. For my project on sustainability, we first convened with a group of surgical services employees that have a passion for sustainable practices. We met and discussed the areas of opportunities we had with recycling, namely around cardboard. We then met with a local recycling plant manager, and he pointed out the reality of the situation. We would have to sequester all of the material we wanted to recycle before it enters the patient care area. Once it enters the operating room with a patient present, he is no longer able to accept it as it would be considered regulated medical waste, even if it never technically comes into contact with bodily fluids or medical fluids. He also discussed the fact that we would need to have a certain amount of cardboard until he could amass the amount that he required. That would require a significant amount of space, which we simply do not have. After this conversation, we sort of lost our motivation, and I started to look for another solution. I reached out to a department that sees more cardboard than we do, which is our supply or materials management department. They take in all the products that come to the facility for use. The manager of supply informed me that there's already a way to recycle. On the dock, there is a baler that will reduce the size of the cardboard waste, and then supply could take the material to the warehouse to house it until the recycling truck comes to pick it up. Since there's already a practice in place at the organization, our department can simply mirror that practice. We just need to obtain a few carts for transporting the cardboard and educate our staff about sequestering the appropriate cardboard for recycling purposes. They will need to be educated about what can be recycled and what cannot. While we have not yet fully implemented this process, we are clearly on our way to doing so. While our department will not realize a cost savings as a result of this project, our contribution will be much bigger. We will become part of our organization's ability to decrease by almost 50% of the solid waste that we currently place into a landfill. And that for me is a victory in my book. What I've come to realize during this project is that Envita Health could really use a sustainability committee. That would be a place where ideas could be funneled and data can be compiled and be shared amongst all of the departments in all the various areas of the organization that are working towards reducing our carbon footprint. What I found is that there was no central location to get all of the information that I was seeking, and that a lot of people just didn't simply have that. There was no way for me to truly calculate our carbon footprint because there is no centralized location for all of the data that's being recorded. And I think a sustainability committee would be a great way to get that going. And as I was reaching out for information from various departments, I had a lot of individuals who were very interested in starting such a committee. So that will be my next step on our journey to sustainability here at Envita Health, creating a sustainability committee. I want to give a huge shout out to those individuals who helped make this video come to fruition. I especially want to thank the main operating room staff here at Envita Health and our partners at the supply department here at Envita. Without you guys, I couldn't have made this video, as I truly do appreciate everything you do here and everything that we're doing to take steps to becoming more sustainable.